Thank you. This week we told you about a new report on Mississippi's medical cannabis program. It shows that our state is gaining on average 50 active cannabis cards each day. The report was done by the Mississippi Medical Marijuana Association. The group is also lobbying for changes in the upcoming legislative session. Noah Noble explains.
The Mississippi Medical Marijuana Association, or 3MA as some call it. The organization basically lobbies on behalf of the medical cannabis program, and it would like to see some changes on the legislative level. The first of its policy goals is potency reform. The state caps THC percentage in flower at 30, and the cap for concentrates is 60%.
By arbitrarily capping it at 60%, you're not preventing anybody from necessarily getting any higher, quote unquote. You're just, costing them more. These patients are basically just smoking more, which is objectively, not great for your health.
It also wants to see eligibility reform, like expanding access for rural patients.
There's 35 counties in the state of Mississippi that don't have a licensed cannabis certifier. So there's not a doctor for which you can go to see and get a cannabis card in 35 counties in Mississippi.
Right now, these are the list of qualifying conditions for the medical cannabis program. Association Director Henry Chrysler believes that should be up to the patient's doctor.
Our proposal would simply, allow for practitioners to determine for themselves whether or not medical cannabis might be better for a patient than, opiates or benzodiazepines. And this is one of the only programs, if not the only program that I know of, where, the legislature seems to step in front of, a relationship between a practitioner and a patient. There's not a qualifying list of conditions for Xanax.
3MA also wants to see patient card renewal pushed to 24 months instead of every year and remove the mandatory 6-month follow-up. For WLOX News, I'm Noah Noble.